Hey guys, today's topic is why blood clots are most commonly seen in the COVID patient. Before getting into detail, we have to study about its structure and the pathophysiology. In pathophysiology itself, I am going to explain why blood clots are common. Now we are going to study about the structure of the coronavirus. It consisting of 4 types of structural proteins. First one is the membrane protein. The structure of the coronavirus is maintained by the membrane protein. Okay. Next one is the envelope proteins. These envelope proteins are embedded in the membrane of the coronavirus and they are helpful in the assembling, maturation and the budding of the virus. Next one is the nucleocapsid. Nucleocapsid is going to bind with the genetic material of the coronavirus, that is single stranded RNA, and it helps the virus to replicate. And the last and important one is the spikes. These spikes are divided into 2 types, S1 and the S2. These S1 spikes are most important because of that this coronavirus is going to bind with the ACE2 receptors. ACE2 receptors. Okay. And S2 will also help in the fusion between the host cell and the virus cell. This is all about the structure. Next one is the pathophysiology of the virus. When this virus enters into our body through the inhalation process, is going to bind with the ACE2 receptors. These receptors are present in different parts of our body. They are present in the lungs, they are present in the kidney, they are present in the GIT. So this virus tries to bind with the ACE2 receptors. We know that coronavirus is most commonly affecting the lungs, right? So we are taking here the alveoli as an example. After binding to the ACE2 receptors, the genetic material of the virus is going to enter the cell, right? After entering, it's going to attract large amount of ribosomes from the endoplasmic reticulum and the Golgi apparatus, so that replication of this virus is going to start. Some parts of RNA virus, some parts of envelope protein, some parts of spikes are formed here. So to assemble that, this virus needs envelope protein. We already read before that envelope proteins are helpful in the maturation of the virus, budding of the virus and the assembling of the virus. So because of that protein, this virus will get structure. Okay. After getting its structure, this virus tries to come out of this cell by a process called as budding. During this process, it's going to damage the host cell wall. So if this host cell wall is damaged, the content present inside the cell are going to come out and it may lead for the death of that cell. Or if there are any natural killer cells like neutrophils and macrophages, they are going to notice that this cell has undergone some type of infection. It may be bacterial or viral. It just see that there are some proteins are absent on its cell wall, so it is infected. So we have to kill this cell. So it undergo phagocytosis. Okay, this is all about the pathophysiology of the coronavirus. We know that the virus is going to infect the alveolar cells, but these alveolar cells are divided into 2 types, type 1 pneumocytes and the type 2 pneumocytes. These type 1 pneumocytes are in larger number. They are around 95%. The main function of these cells is the gases exchange. And next one is the type 2 pneumocytes. Type 2 pneumocytes are less in number, around 5%, and they are going to secrete some substance called as surfactant. The main function of this surfactant is to maintain the stability of the alveolar sac. Normally the virus is going to infect these type 2 cells. Because of that reason, the presence of surfactant is reduced here. That means the stability of the alveolar sac is not maintained here, which lead to collapse of the alveolar sac. If it occurs, the gases exchange is going to be tough. Because of that reason, the breathing problem is seen in the COVID patients. Normally, when the person get injured, it may be intrinsic or extrinsic. His immune system will be activated, right? First, the innate immunity is going to activate. How it is going to activate? Infected cells and the surrounding cells are going to release some inflammatory mediators. These inflammatory mediators are nothing but histamine, bradykinin and leukotrienes. These inflammatory mediators are going to attract large amount of macrophages and the neutrophils from the blood vessels. They are going to reach the infected site and they are going to fight against the coronavirus. During that fight, during the phagocytosis or phagocytic process, the macrophage is going to release some type of chemicals into the body. They are cytokines and the chemokines. Examples of cytokines are interleukin 6, interleukin 12 and interleukin 1. Okay. Now we will see the function of the cytokines and the chemokines. Cytokines are the main important reason for blood clots. Why? Because they are going to increase the permeability of the blood vessels and also it's going to attract the large amount of leukocytes to come out and to reach the infection site. Okay, because of that reason, if the permeability of the blood vessel is increased, the total fluid content in the blood is moving out of the blood vessel. If this occurs for a longer duration, the blood vessel remains with only blood cells. That means the viscosity of the blood is going to increase here. If the viscosity is increased, the large amount of leukocytes come in contact with the endothelial cells. Adhesion property of the leukocytes and the endothelial cells is enhanced by the cytokines. If this process continues, the transmigration of the leukocytes occur in a larger amount. That means they are going to damage the blood vessel severely. If the blood vessel is damaged, the underlying tissue is exposed, that is basement membrane. This basement membrane contains the von Willebrand factor, which is going to attract large amount of platelets, neutrophils, WBC, and it going to form a clot here. Okay, we know that the viscosity of the blood is too high, right? Because of that reason, the blood clot formation is also too big. Okay, this is one of the reasons for the blood clot which we see in the COVID patients. And the second reason for the formation of blood clots in the COVID patient is ACE2 receptor reduction. In a normal person, when the BP is reduced or in the hypotensive condition, the angiotensinogen is secreted from the liver. Okay, after that, this angiotensinogen is converted into angiotensin 1, which is with the help of renin. Okay, and this renin is secreted from the kidney here. Now this angiotensin 1 is converted into angiotensin 2 in the lungs, because these lungs are going to produce a substance called as angiotensin converting enzyme 1. This angiotensin 2 is having different types of functions. First one is they are going to increase the blood volume. How it is going to increase? By increasing the water absorption and the sodium absorption from the kidneys. And next one is it led for the vasoconstriction. Okay, and it also act like a pro-inflammatory substance. This angiotensin 2 is going to bind with the 81 receptors on the cell and produce an enzyme called as ROS, that is reactive oxygen synthase. This ROS is going to damage the cell wall. That is nothing but the angiotensin 2 is damaging our own cells. Okay, to prevent this, to compensate this reaction, this angiotensin 2 will also bind with the ACE2 receptors. Okay, when they bind with ACE2 receptors, the angiotensin 1 to 7 is formed here. The function of this angiotensin 1 to 7 is it acts like a vasodilator and it acts like an anti-inflammatory. To compensate this pro-inflammatory action, the angiotensin 2 is going to produce the anti-inflammatory by binding with these ACE2 receptors. By this we know that the importance of the ACE2 receptors. In a normal person, it is very important to balance the angiotensin 2 and the ACE2 receptor proportion. Okay, but in COVID patients, what happens is these ACE2 receptors are reduced here because the virus is going to attack these receptors. Because of that reason, there won't be any limit for the angiotensin to show its action. So we know that this angiotensin shows the pro-inflammatory reaction, right? As a pro-inflammatory reaction, it is going to secrete a substance called as ROS, that is reactive oxygen synthase. Because of that enzyme, it is going to damage the cell wall of our own cells, which lead to cell damage. And second one is, it is going to increase the activity of macrophages. When these macrophages activity is increased, the concentration of the cytokines is also increased in our blood. That the main function of the cytokines is to increase the permeability of the blood vessel. Because of that reason, the blood volume concentration is decreased. Again, if the blood volume is decreased, this liver is going to produce angiotensinogen. We know that these cytokines are one of the most important reasons for the blood clots. We don't see these blood clots only in the lung, because these ACE2 receptors, that is nothing but angiotensin converting enzyme 2 receptors, are present all over the body. They are present in the blood vessels, they are present in the brain, liver, lungs and all. So because of that reason, even in these areas we see blood clots. Okay. Next reason is the steroids. Normally these steroids are going to increase the clotting factors in our body. Because of that reason, we see clot formation in the blood vessels, right? These are the three reasons. That is, first one is the cytokines, and second one is the ACE2 receptors. Because of their reduction, we see pro-inflammatory action is increased, and which led for the clot formation. And third one is the steroids. These are the three reasons why blood clots are most common in the COVID patients.